In this video, I'm going to discuss how stimulation of baroreceptors will regulate the heart rate, and then how stimulation of chemoreceptors will regulate the respiratory rate. So the respiratory center is located in the medulla, and there are three different factors that can act on the chemoreceptors. And these factors include the arterial partial pressure of the carbon dioxide, arterial partial pressure of the oxygen, as well as pH of the blood. Now you should note that the PaCO2 and pH are connected to each other. So as you affect one factor, the other one will also be affected. And the reason for that is that CO2 plus H2O via the carbonic anhydrase enzyme will give H2CO3. And then H2CO3 will dissociate into the H plus bicarbonate. So bicarbonate is a weak base while H plus is a strong acid. So as we go to the right side of the reaction, the environment will become more acidic. And so therefore the pH will decrease. Now conditions that will push the reaction to the right side is, for instance, elevated concentration of the CO2, which will push the reaction to the right side. So as we increase the partial pressure of the carbon dioxide, therefore the environment will become more acidic, and thus pH will decrease. Now with that information in the background, let's go through these receptors and discuss their function in the regulation of the heart rate as well as the respiratory rate. So the baroreceptors are including the aortic arch baroreceptors as well as the carotid sinus baroreceptors. So with elevated blood pressure, what happens is that there would be more pressure on these baroreceptors, as a consequence of which there would be more firing. And so with more firing from these receptors, there would be decreased SNS activity but increased peripheral nervous system activity, as a consequence of which heart rate will decrease. And then reverse of these events happen with decreased blood pressure. Now one main difference between aortic and carotid baroreceptors is that aortic baroreceptors only respond to high blood pressure, while carotid baroreceptors respond to both high as well as low blood pressure. And therefore carotid baroreceptors are the primary baroreceptors in regulating the heart rate. One other difference is that aortic baroreceptors relay information via the vagus nerve, while the carotid baroreceptors relays information via the glossopharyngeal nerve. And from here on, these cranial nerves will send signal to the solitary nucleus in the medulla to help regulate the heart rate. Now one important concept that you should know is that you should know how elevated intracranial pressure will lead to bradycardia or decreased heart rate. So what happens with elevated intracranial pressure is that it will cause constriction of the arterioles, as a consequence of which there would be cerebral ischemia. And so therefore there would be a reflex sympathetic nervous system activation to increase the blood pressure. And so with increased blood pressure, now there would be more activation of the baroreceptors and thus more firing from baroreceptors. And as we just discussed earlier, more firing with the baroreceptors causes decreased SNS activity but increased peripheral nervous system activity, as a consequence of which now the heart rate will decrease. So elevated intracranial pressure will lead to bradycardia, and this entire reaction is referred to as Cushing's reaction. Next, we have the chemoreceptors, which are divided into peripheral and central chemoreceptors. So the peripheral chemoreceptors, which include the carotid as well as aortic bodies, respond to low PO2, high PCO2, as well as low pH. And then as we discussed, PCO2 and pH are connected to each other, versus central chemoreceptors, which are only responding to high PCO2 or low pH. Now of course these two are connected, but central chemoreceptors do not respond to the changes in the concentration, in the partial pressure of the oxygen. So partial pressure of the oxygen does not stimulate the central chemoreceptors, while partial pressure of the CO2 or pH are the only factors that can affect that. And so with the stimulation of the chemoreceptors, there would be activation of the respiratory center in the medulla, as a consequence of which now there would be increased respiratory rate. And so with increased respiratory rate, there would be increased partial pressure of the oxygen, decreased PCO2, and then pH will be adjusted, because as we decrease PCO2, the environment becomes less acidic, and so the decrease in pH will be corrected. Okay, now we are done with the discussion of baroreceptors and chemoreceptors. The last thing I would like to show you here is a memory aid to help you which baroreceptors or chemoreceptors are specific in their response. So as a reminder, aortic baroreceptors are only responding to high blood pressure. So here we have the blood pressure for the aortic baroreceptors, versus the central chemoreceptors, which are only responding to the high PCO2, and then PCO2, as we discussed, is also related to the pH. So PCO2 and pH are the ones that are acting on the central chemoreceptors. And then the peripheral chemoreceptors will respond to everything, PO2, PCO2, as well as pH, versus the carotid baroreceptors, which also respond to everything, both high blood pressure and low blood pressure. So the receptors that are limited in their response is the central chemoreceptors, which are only responding to PCO2 and pH, as well as the aortic baroreceptors, which are only responding to high blood pressure, but not low blood pressure. And that concludes our discussion.